New Orleans chapter cervical cancer education session. We hope that you can take away from this education session useful information to learn more about early detection and prevention for not only yourself, but for other women to help prevent and bring awareness to cervical cancer and its effects. Please join me for a word of prayer. Lord, we just thank you for another day. We thank you for allowing us to gather this evening. We pray for anyone who may be battling cervical cancer, dealing with a diagnosis, and also those that are suffering with COVID and any other illness. We pray for a great year to come for not only the National Coalition of Black Women, but for everyone gathered on this call tonight. In Jesus' name that we pray, amen.
Amen.
Mm, mm.
And we want
20, I'm
greeting
sorry.
by our president, Greater New Orleans chapter, Gemma Mendoza.
Thank you. 2020 was a year for the history books, and 2021 is also leading in that direction. Good evening. I am Gemma Mendoza, President of the Greater New Orleans chapter of the National Coalition of 100 Black Women. On behalf of officers and members of the Greater New Orleans chapter, I greet our partners, those participating via Zoom or Facebook Live, survivors of cervical cancer, and our distinguished guest speakers. For those who are not familiar with the coalition, I will provide you with a brief overview of our history of this organization. The coalition has been in existence since 1970 and was known as the Coalition of 100 Black Women. This organization was led by visionary Edna Beach in New York City. In 1981, as the coalition gained recognition through grassroots community activity, they decided to expand beyond New York City and include national in the name. The National Coalition of 100 Black Women, also known as NCBW, was launched October 24, 1981. Jewel Jackson McCabe was selected as the first national president. NCBW is a 501c3 nonprofit organization. NCBW is comprised of 60 chapters in 21 states. Our mission is to advocate on behalf of Black women and girls. Through advocacy, we work as change agents to influence policy that promotes gender equity in health, education, and economic empowerment. We hope to realize our vision of seeing Black women and girls living in a world where socioeconomic inequity does not exist. The Greater New Orleans chapter was chartered on September 24, 1988, and incorporated on January 24, 2000. The Greater New Orleans chapter is comprised of a diverse group of women, and we follow the mission of our national organization. Our cervical cancer awareness program today falls under our health programming. In closing, I thank the Health Committee for bringing awareness to this timely topic. I know the information will help us understand the disparities that exist in screening and also help us better understand how to advocate for better outcomes. Thank you and enjoy the program.
Thank you, President Mendoza. And so I am going to just give an overview of the program and the occasion. And so just kind of duplicating what President Mendoza has said. The mission of the National of 100 Black Women is to advocate on behalf of Black women and girls to promote leadership, development, and gender equity in areas of health, education, and economic empowerment. And so the initiatives we focus on are designed and implemented in response to the critical national issues that affect the African American community. As we know, health is a vital component of a thriving community, of the whole of the well-being of the whole community. And as a whole person, whether it's physically, emotionally, mentally, spiritually. Our primary focus is to advocate in the areas of family and childhood obesity, mental health, cancer, disparities, health disparities, metabolic syndrome. And so these are the things that the National Coalition advocate for and try to bring awareness around within our communities. And so we know it's important to improve our overall health outcomes. And so the occasion why we are here today is January is National Cervical Cancer Awareness Month that's celebrated. And so we know that according to the CDC, Center for Disease Control and Prevention Institute, cervical cancer was once one of the leading causes of cancer for death in women in the United States. However, today's screening, prevention have greatly reduced the impact of this form of cancer, cervical cancer. But still, there are more than 13,000 women in the United States that are diagnosed with cervical cancer. And so, and then more than 4,200 women die from this disease each year. And so we know that through increasing screenings, prevention are key components, efforts to eradicate this issue with cervical cancer. And since almost all cases of the disease are caused by human papillomavirus infection, vaccines or HPV vaccines are available to protect women from contracting this virus and to preventing the mass majority of cases. And so we have to do a better job of educating our community in getting pap smears, being educated, and leading to more effective treatment of the disease that can eliminate cancerous cells. So as the National Coalition, we try to do our best effort in educating the community on certain health disparities to reduce those disparities in the African American community. And we know cervical cancer in the African American community is more twice more women are dying because of cervical cancer in the African American community than white people and other populations. And so the National Coalition, we try to educate our folks in the African American community to bring awareness around this issue, and many other health disparity issues, to eliminate and eradicate certain health disparities. So that brings us here today. And so we are here today to try to bring awareness around cervical cancer, education, and awareness. And so we are gathered with folks in the community, our guest speakers. And so we just want to shed light and bring awareness on this issue. And so as we move on through our program, we are moving on to our introductory of our guest speaker for tonight. And Central Alfred Ewell will lead us in introducing our next guest speaker for this event tonight. Thank you.
Good evening. Our distinguished guest for the evening is Dr. Denise Rubion Johnson, Clinical Director of the Louisiana Breast and Cervical Cancer Program, New Orleans site since October 2005. Dr. Rubion Johnson was instrumental in restarting the program post-Katrina, having been the only clinical person from the program to return to New Orleans in September of 2005. In 1986, she began her nursing career as an RN graduate of Charity Hospital School of Nursing and worked in the pediatric ER. 2 years later, she received a Bachelor of Science in Nursing from Loyola University. She then obtained a master's degree in nursing, obtained a clinical nurse specialist degree in community mental health, and became an adult nurse practitioner with board certification by both AANP and ANCC from LSU. A clinical doctorate was received from Chatham University in Pittsburgh, Pennsylvania, with the clinical focus being on recognition of breast abnormalities. She is board certified by the National Consortium of Breast Centers, NCBC, and trains both physicians and medical students in recognition of breast abnormalities. Her continued education and proficiency activities have been performed at both MD Anderson in Houston, Texas, Johns Hopkins Hospital in Baltimore, Maryland, He annually attends the Miami Breast Cancer Conference to get the latest updates on treatment and care for women diagnosed with breast cancer. She was a recipient of the New Orleans City Business Award for Outstanding Medical Care as a Healthcare Hero in 2010. She has also received the American Cancer Society Spirit Award 2006 for her work with women with breast cancer. In 2010, she was awarded the American Cancer Society's Volunteer of the Year Award for her tireless efforts in volunteering her time to get the message out to women about the importance of early detection through mammograms. In October of 2010, she held an open house in our state of the art breast center, which was a comprehensive health clinic where uninsured low income women could obtain breast care in a beautiful, relaxed setting. She has been awarded proclamations by the city of New Orleans 2012, 2013, 2014, 2015, 2016 for her work in educating women on the importance of early detection and the availability of resources provided by the program. Ladies, she's a legend in her own field. Without further delay, I present to you Dr. Denise Rubion Johnson.
Hi, thank you. Y'all, I have to apologize for with the PowerPoint presentation. With this working from home, I don't have the team of IT people that I usually have. So Dr. Centino is gonna have to walk me through on how to actually get the PowerPoint onto the screen. So bear with me, guys. But I thank y'all for having me here today, and I hope somebody can learn something from the presentation. I'm just waiting for the okay to share the screen.
Do you need me to share your?
I'm just waiting for the okay to share the screen.
Make her co-host.
So Denise, Dr. Johnson, I'm gonna make you a co-host.
Do you need me to share your? I'm just waiting for the okay to share the screen.
Okay, so I made you a co-host,
her
Dr.
co-host.
Johnson. So you should be able to share your screen.
So Denise, Dr. Johnson, I'm gonna make you a co-host. Do you need me to share your? I'm just waiting for the okay to share the screen.
Okay, so I made you a co-host, Dr. Johnson.
Okay, I'm trying now to share the screen. Oh, great. Let's see. Okay, are y'all able to see the screen? Okay,
Yes.
good. As I was introduced as the clinical director for the Louisiana Breast and Cervical Early Detection Program, it is breast and cervical cancer that I provide care for. But in the beginning, I mostly took care of women with cervical cancer and all kinds of cervical problems. After Katrina, when all the providers left the state, I had to reshift that focus, and I was sent back to get training at MD Anderson to focus on breast. So therefore, most of my bio told about my history with breast cancer, but I started out with cervical cancer. So just to give you a brief overview of cervical cancer, it's the cancer that starts in the lower narrow end of the cervix and is highly preventable in most Western countries because of screening pap smears and the human papilloma vaccine. That's the HPV vaccine that Dr. Centino spoke of earlier. There are more than 150 different strains of HPV, and it is the most common virus that's passed through skin-to-skin contact. People can pass the HPV virus even if they don't know they're infected, because most time people don't have any signs or symptoms for HPV, so they don't even know that they have the HPV virus. The majority of infections with HPV can resolve over time. So like when I was doing the cervical portion of the program, when a young woman tested positive for HPV, we didn't immediately do anything for her. We just did watchful waiting, because a younger person's body can heal and the HPV can be resolved without any type of intervention. However, older women, it's a little more difficult because the body is able to fight off some strains of the HPV virus. Some strains of HPV associated viruses can cause cervical cancer, genital warts, throat and mouth cancer, oropharyngeal cancer, cancer of the penis, vulva, and vagina. And even though HPV cannot be treated, the cellular changes that it causes in the cervix can. So that's what we focus on, trying to fix or repair the cellular changes. Even though we can't get rid of HPV, it's going to be with people for life. Because HPV is so common, any woman who has ever had sex in their lives can get cervical cancer. By age 50, at least 4 out of 5 women will have been infected with the HPV virus at some point in their lives, and they won't even know it. And that goes for men and women, because once again, there's no outward signs and symptoms most of the time unless you're actually tested for that. You can get in a new relationship with somebody. Your partner can have the HPV virus, and he can transmit it to you, and he could not even have been aware that he had it. So it's one of the viruses that is really of concern in the general population. Risk factors that cause cervical cancer are smoking, women who are HIV positive, or men who are HIV positive, because their immune system can't help fight off the virus. Using birth control pills for more than 5 years, having given birth to 3 or more children, having multiple sex partners, organ transplants, the use of steroids over a long time, and if your mother took a drug called DES, which is another name for a drug called thalidomide, that we don't even use that drug anymore, but back in the day, women used that drug to prevent them from having a miscarriage. And that drug has led to cervical cancer in the babies that were born to those women. Cervical cancer had the second highest incident rate here in Louisiana when compared to the national rate. Now that's a really high number, and it's not a good number at all. Louisiana ranked 9th in the country, attributed to women with death. So cervical cancer was 9th, and it attributed to the deaths of African-American women higher than it did with white women. And it was more than because we ranked, I think, number 10 in types of cancers that we found in Louisiana, because Louisiana is known to be Cancer Alley. And that was in the top 10 types of cancers that we have. Around 230 new cervical cancers are expected to be diagnosed, and 80 of those patients are expected to die in Louisiana in 2017. Now, if you notice, the numbers that we're using tonight is based on 2017, 2015. The CDC compiles numbers every 5 years or so. So the numbers that you're getting now are the most recent numbers that we have compiled from the Louisiana Tumor Registry and the CDC, who is actually our boss. So you can have a visual of what cervical cancer incidence rate is in Louisiana. 7.9% of white women is slightly higher than the national average for getting cervical cancer, whereas African-American women is 11.7, which is significantly higher than the national average. When you compare the death rate for white women to the national average, Louisiana's rate is slightly higher for white women, but African-American women, it is higher significantly again. And this is a graph to show you, for people who like visual things to look at. When you look at Louisiana, we're the blue, and the United States is the kind of checkered one. For white women, the cervical cancer incidence rate is slightly higher than the national. But when you look at Black women, we're significantly higher than the national average. And you can see that from the bar being way over the checkerboard that's on the left-hand side. For women dying or mortality, White women are just about what with the national average. African American women are once again higher than the national average for dying with cervical cancer. So what kind of signs and symptoms do we look for when a woman has cervical cancer? Well, early on, there's no signs and symptoms at all because it could be stuff that's related to something else. But when they have advanced cervical cancer, they can get bleeding from the vagina, which isn't normal, like their normal menstrual period. They can bleed every time they have intercourse. They can get an unusual discharge from a vagina and pain with intercourse. So any of those symptoms need to be reported to the healthcare provider so they can be evaluated for cervical cancer. So how is cervical cancer diagnosed? Well, we do it through a pap smear test. And the pap smear looks for precancerous or cellular changes in the cervix. And if not treated appropriately, can turn into cervical cancer. We also do a test called an HPV test, which looks for the human papillomavirus or cellular changes that causes cervical cancer. And this test can be performed in conjunction with the pap smear. Louisiana is pushing for the ability to do the HPV testing without doing a pap smear because the cancer rate is really high here. So we're trying to figure out ways that we can help African American women not die from this disease. And anybody who's a woman who's ever had a pap smear know that's one of our dreaded visits because I tell them the dentist and the GYN has got to be the most visit because people are like, you got to open wide on both visits. So that's not our favorite visits. So, but everybody who knows, you have to put your feet in the stirrup and we insert a little brush and the little brush takes off cells out of the cervix, which is the little opening right in the middle of the cervix. We take the cells and sample them from there and send that off and we do a reflux test to look for the HPV virus as well. Pap smears are recommended for all women between the ages of 21 to 65. Women ages 21 to 29 should have a pap smear every 3 years. Starting at age 30 through 65, the co-test for the HPV virus is done along with the pap smears. But women who are at high risk for cervical cancer should plan with their healthcare providers to have this test done at an interval that's right for them. Here in Louisiana, we have opted to do pap smears every year on the patient population we serve because of the high cancer incidence and mortality. We're not putting off every 3 years like the recommendation calls for because we have to look out for the patient population we serve. And I serve women who, and I say serve, because I am grateful to be able to serve the population who are uninsured. So we serve a population who don't have insurance and they're low income. So they're less likely to get to the doctor before cancer has spread. Women who have had cervical and precancerous changes on their pap smears should have a pap smear for 20 years after they've had that abnormality, because even though it's treated, it could return. Age 65, screening recommendation depends on your past pap results. If the previous pap test was negative for 10 years and there were no precancerous cells noted on the pap smear in the past 20 years, no pap tests are needed. However, if you introduce a new partner into your life, that clock starts ticking all over again. So say for instance, you were 10 years HPV or cancer free of the cervix. If you get a new partner, you're gonna have to go another 10 years with getting pap smears to ensure that your partner didn't possibly carry the HPV virus and he was not aware of it and you were not aware of it, but so that it can be picked up and treated appropriately, 10 years of screening will be necessary. Women who have had a history of CIN2 or CIN3 or adenocarcinoma should not stop screening at 65. Some doctors recommend that women stop getting pap smears at 65, but once again, if they had cancer or precancerous cells on the pap smears, they need to continue the pap smears for at least 20 years if the lifespan is that long, but at least the next 10 years, because the cancer can be picked up. If a woman has does she still need a hysterectomy? I'm sorry, if a woman has had a hysterectomy, does she still need a pap smear? And the answer to that is, if the cervix was removed secondary to CIN2 or higher, more testing will be needed. But if it was not done because of the woman having abnormalities, she can stop doing a pap smear because there's no service to gather cells from. But they can do a bimanual exam, which is feel inside the vagina. Manual exam, no growths on the walls of the vagina or on the inside or the vulva, and do a visual exam. Women who have had high-grade lesions before the hysterectomy should continue screening every 3 years for the next 20 years. If an abnormal pap test is noted, the doctor may order something what's called colposcopy. And colposcopy was something that I used to do at the St. Thomas Clinic before Katrina. And that's a visualization of the cervix, where we look at inside of the cervix with a special microscope to see if we see any abnormalities. Or they can have what's called an ECC, or endocervical cauterage, where we insert a small spoon-like instrument into the cervix and scrape some cells off the cervical wall so that we can send that off for testing and analysis. Because sometimes cervical cancer is so deep inside the cervix, we can't visualize it with the colposcopy machine. So we have to go in and collect cells that way. And that's just to show you what a colposcopy looks like. Your legs are in the stirrup, the speculum is inserted, and we look through the microscope into the vaginal vault to ensure that what we're seeing is indeed what we're going to go after and target. This is what an endocervical cauterage looks like, or ECC. Once again, we insert a small spoon-like instrument inside the cervix, scoop out some tissue, and then pull that out and send it off to the lab to be evaluated. Now, this may not mean anything to any of you all, but when we're looking into the vagina or the vaginal area, this is what we want to see: a nice, pretty cervix. There's no abrasions, no anything on it. It's nice and pink, really healthy. This is what we want to see. And a lot of times when women bleed with intercourse, we tell them it's not necessarily cancer. This is a polyp, and polyps were removed by me in the clinic, on that visit, because it's just an overgrowth of tissue, which is hormone related, so it can be removed, and no further follow-up is needed with that. A cervical polyp is not a cancer or a precancerous condition. It can be removed and be done with that. But this is mild cervical dysplasia called CIN1. This is the beginning of cervical cancer. So when we see a woman has CIN1, we can easily clip off the areas around the cervix so that it doesn't progress into cervical cancer. This is CIN2, which is moderate cervical cancer. And this is another area of concern. We're going to have to do some laser ablation to remove that area so that the cancerous cells can be removed and the area can heal on its own. This is CIN3. This is severe cervical dysplasia. So this is of concern because you're going to have to take out more tissue and it's going to have to be removed, and it may even result in a hysterectomy or just a removal of the cervix, because this is a severe and it will rapidly progress to cervical cancer if not treated and if it goes undetected. This is another view of what CIN3 would look like, and that's severe dysplasia, which is also cervical cancer. And, even though these pictures are graphic, I minimize them to what I showed you, but I wanted everybody to see the severity of what we see here in Louisiana. These are actual patients of mine from the time when I was actually doing the cervical component. And this lady had to have a hysterectomy because there was no way we could remove all those cancerous cells, as you can see, because it's taking up the whole cervix. This is invasive cervical cancer, which has started to move outside of the cervix and the vaginal vault. And if you can see, there's bleeding down at the bottom. This can only be resolved through a hysterectomy. But the hope is that it hasn't spread to the other portions of the vagina, or the vulva, or the lips of the vagina. So we have to make sure those areas are not affected as well. But that's a severe case right there, and the only treatment for that was a hysterectomy. So how do we prepare women for a pap test? Well, women should schedule a pap test, but they shouldn't do it while they're on their menstrual cycle. Healthcare providers should inform women that 2 days prior to their pap test, They should not do any of the following. They shouldn't douche or use any kind of vaginal rinses in the vagina. They should not use a tampon. They should not have sex, use birth control foam, cream, or jelly, or use any kind of medication in the vagina, because that would interfere with the actual results that we would get. It would obscure the results, so you wouldn't get a true reading going on. Treatments for cervical cancer can vary. It can be surgery combined with chemotherapy and radiation, or it could just be something as simple as surgery. But the treatment would be based on what the oncologist and the pathologist and the primary provider, they come together, they make a plan. And the plan would be based on those findings. So it's not automatically that you're gonna have to have your cervix removed. They can take off a portion of the cervix and not remove the ovaries and all of that, because that leads into other problems once you have to do all of those things. But you may have to be followed with chemo, and it may have radiation. And once again, not everybody gets the same treatment for the cervix, based on the type of cancer you had and the stage it was in at the time of diagnosis. So just to know about HPV vaccine, it is available, and it's most effective on type 6, 11, 16, 18, 31, 33, 45, 52, and 58. And the HPV vaccine is recommended for girls age 11 through 26, but they can start at age 9 with their regular immunizations. And boys can get the HPV vaccine from ages 11 to 21. The HPV vaccines are administered as a 2-dose series for ages 9 through 14. And then the series will be initiated from ages 15 to 45 on immunocompromised people, somebody with HIV or something, disorder like that. Anything that interferes with the immune system, they can get it starting at age 15. So once again, we are the Louisiana Breast and Cervical Health Program. That's our website. Both of those, the top one is breast and cervical, and the bottom one is Louisiana Cancer Prevention. And they're available to low-income women. Once again, women who don't have insurance. Those are our target population, and because we're blessed to be able to serve women who don't have the finances to go to the higher paying hospitals, where the treatment would be sometimes different if we really call it what it is. But they're afforded the same treatment that everybody else gets, because we do get funding for them through Medicaid, through this program, so that they can get their chemo, if they have to get radiation, if they have to have surgery, anything that they need in conjunction with that cancer diagnosis, we're able to provide them with it, and they can get pap smears at no cost through this program as well. So that's the end of my presentation. I tried to keep it as short as I possibly could, because I know you ladies have other business to conduct, but does anybody have any questions that I could possibly answer?
Yes, I have a question. I know that you mentioned earlier that Louisiana is considered Cancer Alley. Why is that?
Well, once again, even though I'm employed by LSU, I work for the CDC, the component that I work for. And we gather data which shows us from state to state how many numbers of or incidents of cancer there is. Louisiana has so many types of cancers and so many different cancers. It's higher than in some parts of the country, it's higher than the national average. And Louisiana was given the name Cancer Alleys because there are certain parts of Louisiana that have higher rates of cancer than others. I don't know them offhand, but there are certain parishes or counties that have a very, very high cancer rate. And these parishes are close to refineries, different kind of plants and stuff like that. And I don't know if it's a result of the runoff from the plants or whatever. I don't know what it's a result of, but they have been given that name of Cancer Alley because of the incidence and mortality of cancer in these different parts of Louisiana.
Okay, and one last question. You mentioned high-grade lesions. What does that encompass?
It was the last picture that I showed you. The most graphic of all the pictures, that's a high-grade lesion. The other one was mild, moderate to severe, The severe is considered the high-grade lesion. And those are the ones that are like a medical emergency, because by the time that patient came to us, what we can offer her was limited, because that cancer was so advanced it had spread, and she had to have a hysterectomy and her ovaries removed. It's not always that we had to do all of that, but because her case was so advanced, that was the outcome for her, unfortunately.
Thank you, Dr. Johnson.
You're welcome.
I have a question. Dr. Johnson, you said that about Louisiana being the highest. Where can we find out what areas, what parishes? We go to a state website or something, or LSU website?
LSU has a Louisiana tumor registry, and that site, I think it's Louisiana Cancer Prevention or Cancer Control. If you, I don't, Dr. Centino, is there any way for me to go back to that slide that gave the website?
Yeah, I could share your screen again and
Okay.
go back to, you should be still a co-host.
Okay, let me see. Let me see.
Able to share that screen.
All this technology, y'all. So, this one right here, the LCP, they should have statistics on that site. Can y'all see this?
Dr. Johnson, hit share your screen.
Share my screen. Okay, let me go back out. Hold on, let me come out. Well, I pushed the wrong thing.
That's okay. Dr. Centino can share it with us later then.
Okay, yeah, because
Yeah. That's okay.
I apologize for not being a computer whiz, but that's.
Well, that's okay.
I think I got it again. Is this no? Yeah, I don't think I could get back to it, y'all. I'm sorry.
Don't worry about it. It's okay, Dr.
Okay.
Johnson. Dr. Centino can get it to us.
Okay, and on those sites, and even the CDC has a website that breaks down cancers according to states, and they specify the types of cancers. So you can compare, you can look at the state, and you just specifically look at Louisiana. You can see our rates compared to the national rate, and you'll see we're high up there with different types of cancer.
Dr. Johnson, I have a question.
Yes,
First of all,
ma'am.
thank you for the presentation. It was very informative, great information, great details. We really appreciate you doing this for the organization. One of the questions I have is, what impact are these patients having during this COVID time? Are you guys seeing more and more delayed diagnosis because of COVID over the last year?
Initially it was a problem, but we're actually getting back into the clinics to see people now that the vaccine is rolling out. But basically we're doing a lot of telemedicine, but and as you know, you can't get a pap smear through telemedicine. But there was a delay, and but it wasn't as severe as we anticipated it would be, because we did get the severe cases. We did allow them to come in. It was the hospitals barring women from coming in because of the exposure to COVID, which was a genuine concern. But tests have resolved, mammograms have resolved, so screenings have resolved to try to pick up on these abnormalities as soon as we can.
Thank you.
Dr. Johnson, thank you for your presentation. But I have a question. What is your advice for women with partial hysterectomies?
What is my advice?
For women with partial hysterectomy.
In regards to what?
In regards to pap smears, I'm sorry. Yeah.
So what is my advice for women? Are you from Trinidad?
Yes, I am. God, hey, you picked it up.
I picked it up because my husband's from Trinidad. That's why I picked it up.
Oh, okay. Yes.
Women who have had partial hysterectomies who still have the vaginal cuff, even the cervix is not there presently, they can still swab the vaginal vault, but it would be based on why the hysterectomy was. If the hysterectomy was done for a reason other than a cancerous or precancerous condition, pap smear would not be needed. However, a bimanual exam where they actually feel inside the vaginal vault, that would be recommended, because you want to make sure there's no lesions growing around what part of the cervix is left. Because if you had a partial hysterectomy, sometimes part of that cervix is still there. But if it wasn't removed for, if it was removed for any other reason than cancer, you don't have to worry. If it was cancer, then you still have to get the pap smears or whatever kind of testing they're doing for it at this time.
Okay, thank you.
Okay.
I'll get with you. I'll get with you. Thanks.
Dr. Johnson, I'm glad that you mentioned women that were over, I think, the age of 65. And
Yes.
sometimes when we think when we're up there in age, we don't have to follow the same health guidelines as it relates to preventative measures. And so I know research has shown that women really above 65 has been a large percentage of women that has been diagnosed with cervical cancer. And so I'm glad that you brought that up, because sometimes we think when we get a certain age, we don't have to follow these same guidelines and measures, but actually, you know, as long as we have these organs, right, the cervix,
Exactly.
have to follow these guidelines. And
Because the concern with that is because even though women are in their 70s, they're still sexually active. You have women that are sexually active in their 70s and beyond. You know, if you're sexually active, you still run the risk of getting the HPV virus introduced to your system. So, and even if you got it 10 years ago, it may just show up now in your 70s. So you still have to get the screenings if you're sexually active. And if you have not had a normal pap smear for the last 10 years with no new partner, then you can stop. But if you're still sexually active and you introduce a new partner in the interim of that 10 years, if that clock is ticking all over again, you have to start all over again.
yeah, and that's good that you bring that up. And I even know that with the HIV population, there's, you know, even more concern with HIV and HPV, the human papilloma virus. And so, can you speak a little more about the HIV population and HPV?
So people who are HIV positive, they run a risk of dying from something as simple as a cold because their body they don't have the tools to fight it off. Now, somebody who is HIV positive, if say a person had HPV and was 30 years old, they could fight that off because their body's still young, so their immune system is still working to the fullest capacity. Somebody who's HIV positive, that immune system is no longer working. So if they're 30 years old, they could die and be, you know, they could actually have been exposed to HPV and die from that cervical cancer a lot sooner than somebody else who we picked up on that same cancer because their immune system is not helping us, and they have all kind of other problems going on. So it's a little more difficult to treat people who are HIV positive.
Yeah, yeah, and that's always a concern as well, because we know even in the African American population that there are high rates of persons with that's, you know, that's HIV positive, but then we even know in the African American community with women, we suffer with high rates of cervical cancer more than white women or any other population.
Right.
So it's definitely important that I appreciate the work that you're doing and making sure and spreading the awareness and education to organizations like National Coalition of 100 Black Women, and in the work that you're doing at the Breast and Cervical Cancer Program, because these are things that we need to know in order to educate other folks, and so that it can continue, so that we can decrease this health disparity that's really affecting African American women. So definitely appreciate you coming and bringing this level of awareness and education to us. And I think what we're left with is that we all need to make sure that we're getting pap tests, whether it's HPV vaccine, and I know it's as young as 11, 12-year-old ages, boys and girls, right, sexually active, to make sure that we spread the awareness of getting this vaccine so that we can decrease, because we know that this cancer is preventative.
It is. And if I could leave you all with one thing that's important, you know, African American women and men, they don't take advantage of the screenings like white women do. You know, white women will get their mammograms, their pap smears, colonoscopies, everything that you need for health maintenance. Black women don't do that. When I see a woman coming in there with stage 4 breast cancer, breasts all rotten and excoriating, first thing I'm saying, why didn't you come in sooner? Oh, well, I had to take care of my husband and my grandchildren, and I had to take care of this one and that one. I tell them, think of life like this. When you're on an airplane, and if that airplane is hitting turbulence, they say, put your mask on first, because you can't save the person next to you if you can't save yourself. So you can't take care of the husband and the grandchildren and everybody else if you don't get your own screenings and health maintenance. So it's important for us as women and African American women to get all the screenings and take advantage of all the health maintenance like our white counterparts do, because we're dying unnecessarily. And cervical cancer is so preventable, but the women just aren't getting screened. And it's the same with mammograms. Breast cancer is preventable or is treatable, but if women don't come in and get the mammograms and the pap smears, there's not a whole lot we can do. You know, treatment options are limited by the time I see a lot of these patients. So I thank y'all for having me, and so that I can help spread the word of the importance of early detection for cervical cancer.
Yeah. And we thank you, Dr. Johnson, for being a strong advocate in this area, and advocating for women to eradicate this issue of cervical cancer in the African American community that women face. So once again, we thank you. We appreciate your presentation and coming here and being with us and sharing your knowledge around this issue. So thank you. And I have to say, Dr. Johnson is somebody that is really near to my heart. We have worked together for over probably when I was in my early 20s. We worked in the area of HIV and AIDS, maternal child health. And so I have worked alongside with Dr. Johnson for so many years in those different areas of health. And so I just appreciate her knowledge and the example that she has set for so many African American women and standing in the forefront, and just appreciating her advancement in her career and being an advocate in so many different areas, whether it's HIV and AIDS, whether it's cancer, breast cancer, cervical cancer. I just, want to say that I appreciate her, and I thank her for being here. And our relationship extends probably, Lord, I was probably in my early 20s. And so,
don't tell my age.
And I don't even know if people remember, like, way back in, I don't know what year it was, Denise, but it was almost like it was Denise the nurse.
Yes.
So the nurse was on Q93, and she brought all kind of health knowledge to the community, but that was way back in the.
That's when I first started out in nursing in the ER. Yep.
And so I just, thank Dr. Johnson for how she's evolved and even her knowledge and expertise, and thank her for being here and taking her time out to be a part of this educational session.
Well, thank you all again for inviting me. I really appreciate it.
Yes. And so that brings us, if nobody has any other questions for Dr. Johnson, that brings us to our other guest speaker. And she is going to tell her story. And so I don't want to take anything from her, but I'm going to show us a small snippet of a video. She is very impactful in advocating for cervical cancer, whether it's CDC. She has been an advocate for CDC, an advocate for the American Cancer Society. So I am just going to show a small video of, and she is Tamika Fields, and we'll have an introduction, but I'm going to share my screen to show a small video of what she has done.
There's a virus that causes cancer, the human papillomavirus. Black women develop cervical cancer more often than white women, and we are 2 times more likely to die from it.
Sadly, studies have shown that Black women are more likely to develop cervical cancer
because we have more trouble clearing HPV, the virus that causes cervical cancer.
Screening is important to help reduce this disparity.
So get screened.
Ages 9 to 26, HPV vaccine. 21 to 29, PAP test. 30 and up, get a PAP plus an HPV test.
My mom died from a cancer that can now be prevented. Be a part of something that matters. Let's get rid of this cancer for good.
Our next speaker is passionate about empowerment. Survivor founder Tamika Felder spreads her unique message of survival and resilience with people around the globe. An award-winning television producer, Tamika is recognized as a leading voice in the rapidly growing patient engagement field, having built award-winning patient ambassador programs and awareness campaigns that united patients and industry. The author of Seriously, What Are You Waiting For? 13 Actions to Ignite Your Life and Achieve the Ultimate Comeback. Tamika empowers everyday people to bounce back by equipping them with tools to find perspective after tragedy and loss. I now present to you Ms. Tamika Felder.
Hello, thank you all so much for having me. Thank you for doing this during Cervical Cancer Awareness Month. Everything that we do 365 days of the year is meaningful, but to be with my sisters talking about this and dropping so much knowledge and trying to close that healthcare disparity is phenomenal. I also have to take a moment to say Happy Founders Day to any of my Saras who might be on the call. So happy Founders Day, Saras. I would like to share my screen if possible. Okay.
I'd like to thank each of you.
So,
as well as thank Kiana and her committees for the work that they've done to on their side.
My story started, I'm 45 now, and I can talk about this with ease, with no stigma, no shame, because I understand the importance of talking about it. I understand as a Black woman who was diagnosed with cervical cancer that the outcome of my story could have been very differently. So I was diagnosed at 25, and prior to being diagnosed with cervical cancer, I grew up in South Carolina. And I remember, you know, when I got my first PAP test, then it was age 18, you go every year. We know the guidelines change all the time. And I remember my mom was very adamant about me going. I went through college. Then when I graduated, was leaving South Carolina, moving to Maryland, I remember my mom reminding me, you want to go get checked. She meant get checked, everything from the rooter to the tutor and all that other stuff. And I did it. I went and got screened. I have never met anyone who has woken up and said, it's PAP day. I'm so excited to go get my PAP day. Like, I have traveled around the world, talked to many people, and I've never met one individual who is excited about getting a PAP test, because it's not fun. No one wants to put their feet up in the stirrups. I mean, if there's somebody here, y'all can let me know, and then I can finally stop telling this story. But I have yet to meet that person who thinks that it is an amazing experience. But part of my message is, no matter what, you have to get screened. So when I moved and I started my career, I didn't have health insurance. Like a lot of broadcasters, I started working in television and I was freelancing, but I was young and, you know, healthy, of what I thought was healthy. So why would I need health insurance? It wasn't a deal breaker for me that the job that I got didn't have health benefits. Now, at 45, being a patient advocate, knowing what I know, it's a deal breaker, or there has to be some other thing that happens. So when I did go see the doctor, so there are a multitude of reasons. The presentation from the doctor was so amazing because we know that a lot of women don't take care of themselves. They don't make themselves a priority. You know, whether it's you are underinsured or you're not insured at all, or you're too busy taking care of your family, or you're busy at work. But we must make health a priority. The reason why I'm so excited about this conversation is because we need to talk about cervical cancer the way that we talk about other cancers. We need coalitions and groups to rally around cervical cancer because Black women are dying 2 times the rate of our counterparts, and we need to close that health gap. So it could have been me. I didn't know anything about cervical cancer prior to me being diagnosed. I had heard about every other cancer. I also didn't know that it was connected to the human papillomavirus. And then I was like, great, I get cancer and I end up with this type of cancer. Why? But you don't get to pick what type of cancer you get. You don't get to pick if cancer happens to you, but cancer happened to me. And, you know, you all don't know my personality, but I came out of the womb, according to my parents, with the gift of gab. So I've been talking my entire life. When I was diagnosed with cancer, I didn't want to talk about this. Who would want to talk about something so intimate? I remember the first time I shared my story, and it was in Essence magazine. My mother, she was like, why are you telling your story? And I was like, because I survived it. This is my friend Lillian. Her mother did not survive cervical cancer. Lillian herself was just diagnosed with breast cancer this past spring, which was a scary experience to go through during a pandemic. But thankfully, she had us to help her, you know, and guide her and a lot of loving family and friends. But the thing that I appreciate about Lillian is she's been with me for years. You saw her in that video that was just played talking about her mother's experience. A lot of times when Black women are diagnosed, we are diagnosed too late. We're diagnosed when the cancer is already advanced. We're also diagnosed when there are little to few treatment options. And we also don't go back for follow-up. I want to talk about pre-cervical cancers. So if you've ever had an abnormal pap smear or cervical dysplasia, that is 9 times out of 10 because of the human papillomavirus. A lot of times women don't want to go back because, and again, I can relate to this. Like, maybe I can pray it away. Maybe if I just take these herbs or do this cleanse or reboost my immune system or do whatever, that's not going to happen with cervical cancer. So if there's someone here who has not been screened for whatever reason, no judgment, no stigma, just know that you are worth it. And however uncomfortable or embarrassed you could be because your feet are in the stirrups, you have to change that now because someone's life could depend on it. And that means your life. My journey was not easy. Prior to having cervical cancer at 25, I had never even had a broken bone. I endured a radical hysterectomy, so I can never create life. I'll never be able to carry a child. And that was something that previously I couldn't say easily. You know, and some days I can't say it without completely breaking down. Today is not one of those days, but I may later, when I get off of this, take my shower and those emotions run back, because it was something that was taken away from me, and I have to do something with that. And I'm doing something by trying to save someone else's life by being my sister's keeper. I also had chemotherapy, which burned my body from the inside out to save it. Same with radiation therapy. There are a lot of people who come to me and they say, I'm scared of radiation. I don't want to do this. I don't want to do that. Everyone has the right to make their own decision. But if you are faced with cancer and you don't know what it's like until you hear those words, you have cancer, and it is like a death sentence. No matter how spiritual you are or what you believe, when you hear those words, you automatically think of your life flashing before you. And I will tell you, I had some praying doctors who really poured into me that the best thing to save your life is to kill as many cancer cells as possible. And while it was painful going into the hospital a week before my 26th birthday, and I was scared that I wouldn't wake up, I did. And I promised that I would do something. And at the time, I didn't know what that something was, but I knew that I did not survive to just not thrive. I survived so that I could thrive. And so every waking day, I wake up grateful that I woke up again. I don't take any day for granted, because I know I could have been in the number of people who did not survive cervical cancer. I could have been in the statistics that show how many Black women die of cervical cancer. And I wanted to be more than a statistic. I wanted to show that if your cancer is caught early enough, that your life can be saved. I wanted to show if cervical cancer is caught early enough, yes, there's loss that comes with it, but your life, you will still have life. And I know that because these are three women that I knew personally. Iona, who we spoke about, the Caribbean. She's from Trinidad, her mother, and she had a big fro and loved to dance and was full of life, and cervical cancer ravished her body. Talita, who died a year ago, from Savannah, Georgia. She was a Southern Belle, and she endured stage 4 cervical cancer. She fought, did everything she could, and she succumbed to cervical cancer. Curtissa from Oakland, California, who you ever meet somebody and they are your soul sister? You feel like you've known them your whole life. That's what she was for me. And her cancer spread to her bones and eventually her brain. All young women. Cancer doesn't discriminate. It does not discriminate. It can happen to anyone at any age, at any time. But when cancer happens to people who look like you and me, it ravages our bodies because we're already in a health disparity from the onset. And timing matters, what we do once we're diagnosed with cervical cancer. And so if you were diagnosed with cervical cancer, I want you to be diagnosed early. That means that you have to have a doctor. You can't just have the emergency room when something is wrong. You have to have a relationship with a provider that knows your health history. That means that you have to share information with your sister friends. You have to talk about the uncomfortable things. When I ask my friends, have you had a Pap test? We've normalized, did you get your mammogram? We have to normalize cervical cancer screenings. And yes, we have to be our sister's keepers. We have to care about below the waist stuff as much as we do above the waist. And we don't do that if we're not talking about it. So I applaud each and every one of you, not only for having this platform for this discussion to happen, but showing up and being here for an unpopular cancer. I have to applaud you for streaming this so that others who didn't make the Zoom are able to do it, because Black women die of cervical cancer, and not just a certain type of woman, not someone who was sleeping around or doing whatever. You could sleep with someone one time and get cervical cancer. The way that I make my survivorship count is through my organization, Survivor. As a television producer, I know how to tell a story, so I empower patients and survivors to learn how to use their story to make a change. I want them to speak up. I was devastated when those three died because they were speaking up. Now, a lot of times it's just me, and I want other people. There's a wonderful woman named Angel Purdy who lives in Louisiana. She's gone through our survivors training. She's a survivor ambassador, and she loves to share a story. So I'll definitely be connecting you all with her. But if you meet someone, think what positivity you can pour in their life as a cervical cancer survivor. A lot of times we put our judgment on people, and that silences people. We need to speak positivity and celebrate that they survived. And then maybe in return, they'll want to share their stories. I understand why Black women especially don't want to speak up. We have to change that. In order for us to close that health gap, we need more Black women sharing their stories. And in order to do that, we can't shame them into submission or silence. our organization, I'd love for you all to follow and connect with our organization. We're everywhere. On Facebook, we're Survivor, CERVIVOR. On Instagram, Twitter, and Pinterest, we're I Am Survivor. And our website, survivor.org. If you could do one thing for me, share a story, share a video, share a graphic. Let people know that January is Cervical Cancer Awareness Month. Ask them, have they been screened for cervical cancer? It matters. You could save a life. Someone may fall on deaf ears, or someone may take action. You may never know, but you will know that you did your part to protect, especially us, from cervical cancer. You can always reach out to me. This is my email address. I'm always, that's why I use this picture of me on my phone. I'm always on my phone. If I don't respond, it's because I can't respond, and I'll respond back just as soon as I can. No question is embarrassing. I want you to protect your kitty cat. You know, like I want to. I am in the business. My husband laughs all the time. He's like, you in the coochie saving business. I was like, that's right. Because I don't want anybody to have their coochie burned, cut, you know, like I did. And I keep it real like that because I know people are fearful. So if I almost have to fear you into go getting screened, then I'm going to do that, because a lot of times, as the doctor said previously, we can take care of this in advance. I think about, had I been going to the doctor once I moved here and I was not going to the doctor. Also, as physicians, for the physicians, you have to stop shaming your patients. I had a doctor one time that told me, as soon as I put my feet up in the stirrups and she came towards me, she touched my belly and she said, if you were pregnant, you wouldn't even know your belly's so big. I would know. Or if not, you would tell me. But you know what I did? I said, you know what? I'm going to leave and I'm going to come back. And I never went back. And I'm not saying that had I had that screening done, then my cancer would have been caught. But time and time again, I've thought about that moment that I was shamed. So then I didn't want, because no one already wants to do a pap test, right? We also don't want to ask for an HPV test because I wouldn't have HPV, but I left because I didn't like the way that she talked to me. And I didn't go back until I had to, when it was too late. I want that to change for someone else. And so that is my story in a nutshell, the short version of it. I want to answer any questions that you may have, and I appreciate you all allowing me to be here with you to share my survivor story, because I will share it to anyone who will listen, because I want to make sure that we close the health disparities gap, and we have to stop making it about sex. We have to stop making it about a certain type of person. I know people who are wealthy who get cervical cancer. I know people who are poor that get cervical cancer. The only difference is if you are poor or not so poor, we usually don't make it, or we have very unhealthy outcomes. And so I know that because I meet those women and I talk to them, and we absolutely have to change that, because we can. We have to vaccinate our children, and we have to look at where we're getting information from. Social media is an amazing platform because anybody can be a publisher. Social media is a nightmare of a platform because anybody can be a publisher. A lot of times people look at a sensationalized headline, they don't click and source where the article is or even read it. They just share it and it's gospel. We have to stop doing that. We have to. It is the only way that our numbers will decrease. And so I told y'all I like to talk, so I'm gonna stop talking. And thank you so much for this opportunity to be able to share my story, especially during Cervical Cancer Awareness Month with each and every one of you. Thank you.
Thank you so much, Ms. Felder. Does anyone have any questions for Ms. Felder? Questions, comments? Well, I would definitely like to say that I am very appreciative of the awareness that you are bringing around this issue. And I know you talked earlier about, your plight and your feelings around, not even being able to have children around this issue. Um, but, I thank you for being, persevering in in that, that emotional tug, that you may have about that. I thank you for being proactive and, even going beyond like your own perspective, your own experience, your feelings, and taking that extra step to bring awareness to other women so that they won't have to, struggle and encounter, um, you know, getting diagnosed with cervical cancer, not being aware. And so I thank you for that and bringing awareness. And I can remember just from my own experience in my younger 20s, I was, diagnosed. I had pre-cervical cancer and cancer cells. And so just, I thank God that I was one that was, proactive in getting pap tests and, and and having some awareness about my body and making sure that I get those tests. And it was probably because I got pregnant at an early age that spurred that on. But it's always a reason for something, right? And so I got diagnosed in my early 20s of having precancerous cells, and thank God that I was with a gynecologist that really identified those precancerous cells. She froze those cells, and I got treatment every 6 months to a year to freeze those cells. And so, that prevented me to really the evolvement of cervical cancer. And so, but I'm in my early 20s. I don't know anything. Mm-hmm. So as women, the more we get educated around these issues, the more we can bring awareness. So now I make sure that anybody that's in my circumference, you need to get these pap tests. You need to get this done, right? If there is health disparities, insurance, access to healthcare, I am a component for making sure that women access these, these things that really African American women face as it relates to health disparities, whether it's insurance, access to health care. And so I think we have to, evolve and bring more awareness around this. And I think it affects you when you're more, you have been impacted with it, right? Mm-hmm. And I think you have more awareness when you have been impacted. And so, and I just thank God that I had someone that identified those precancerous cells, that froze those precancerous cells. And now, that could have ended, right, a death sentence, mm-hmm. to truly be honest. And we know that research has shown that cervical cancer is preventable. Mm-hmm. But if we don't get educated, if we don't educate others, then how would they know? And so it's so important that people like you, Dr. Johnson, bring awareness to our community to make sure that we are equipped to better have the conversations around these topics that African American women or women at large face, mm-hmm. with dealing with these conditions that could be deadly, but they can be preventable. And so,
thank you for your testimony. Like, I thank you so very much for that. And the key word that you said is proactive. We have to be proactive, and I wasn't proactive. When I look back on my story, I had exactly what Dr. Johnson said in her presentation. I had bleeding during sex, right? But I passed it off for other things and was like, it'll be fine. It'll clear up on its own. So there were things that I could have done for it to be caught early, but I was not proactive. But I also know now that, my legacy that I leave will not be the lives that I bring into this world, but it's going to be the lives that I save. So that's what I try to focus on. When the state of Maryland denied me my rights for fertility preservation, I went 2 years ago and helped change the law. So now it's bittersweet. It won't help me, but it'll help those that come after me protect and make sure that they're able to have surrogacy or whatever else that they want. And that's what it's about now. But I thank you for sharing your testimony, because that's that domino effect. We open doors and we share and we all save more lives.
Exactly. Yes, yes. And so before Tamika Felder, we thank you. I thank you for being here. Tamika Felder, maybe some of you may not really know the impact that she's making in this area, but she has been an advocate with the Center for Disease Control and Prevention, the American Cancer Society. She's a author, published author, and just internationally, globally, she has made an impact as it relates to transforming the world and spreading awareness around cervical cancer. And so before we move on to our presentation of certificates, I definitely would like to show this last video that it involves Tamika, but it was one that really touched my heart, and I'm sure it will touch your heart. And I just want to share it right now. Just a second, I'm getting to it.
While we're waiting, I just want to thank Dr. Johnson and Mr. Mika Feld. I'm the president of the coalition. I just want to thank you all for effort, for the information that you have provided to us, because I will be honest with you, although I know of the disease, I'm embarrassed to say I never learned anything additional about it. And in a lot of ways, as long as it doesn't impact you, you don't want to know. And I felt like this was a very informational session because it provided me with a lot of information that, whether it's for myself, my family, to spread it on to other women. So I appreciate what what you all have brought to us today, because I, like the other women of this organization, we are the leaders that have to go out into the community, to especially like in the areas that we are in areas of health, education, and it is important that we have this information so that we can inform people. So I thank you all for bringing us this information, and it's valuable. I am just grateful. Like the rest of the ladies, we are just grateful, because like I said, I'm not sure how many other women were versed in cervical cancer. I've heard of it. I've heard of people with it, but never paid attention to it. And I'm just being honest. So thank you all for bringing us that information.
Thank you. And no embarrassment, because now you do know. So
yes, thank you. Yep. So you can go ahead, Dr. Patino.
We don't know what the
I always knew that I wanted to work in television. Southerners are storytellers naturally, and working in television really honed in on those skills for me of telling people stories. I was like, I have to become the next Oprah. I have to chase the next story. It's happening. I'm on red carpets. I'm interviewing newsmakers. covering elections, and life is happening. And just like that, I had cervical cancer. Cervical cancer is linked to HPV, and it's a sexually transmitted infection. Just saying that, like, what's a cancer that's linked to an STI? Hello, I'm Tamika. I've got cervical cancer. Oh, you know the one that's linked to HPV. Why did this happen to me? I did everything right except for going to get screened, but when it came to protecting myself from STDs and things like that, why me? I had to make a decision between my life and future children. I felt ashamed. I felt alone. I didn't like it. I'm like, I cannot be the only person that has this type of cancer. We had these fabulous things called AOL chat rooms. And so I was always looking for women who had experienced cervical cancer. And I realized that this was happening to more people than I knew. Women just weren't talking about it. I wanted these women to talk because as a storyteller, I knew that if we started telling stories, it would shift that narrative, the way that people think and react to cervical cancer. So I had gone on other websites and I had noticed that when they were sharing stories of women who had been affected by cervical cancer, it was silhouettes. I really wanted a woman's face, her state, and her story. And my organization, Survivor, was born. We at Survivor are shame resilient, and we will speak proudly, loudly, and profoundly about this cancer. What other cancers can we say that we know the cause? We have tools to prevent them. Cancer taught me, whatever it is in life that you want, it is yours for the taking. It's time to not hold on to the brakes. It's my duty and my obligation to tell the stories of my sisters who are no longer here. Their stories matter. Somebody else not to go through this. That's probably the best thing I have to offer at this point. We are pleased to welcome back the effervescent Tamika Felder. I thought no one would ever love me because I was barren, that I wouldn't be able to create life inside of me. My legacy will not be lives that I bring into this world. My legacy will be the lives that I save, the women that I saved from cervical cancer.
So I just wanted to share that video because that was very impactful. Really overview of Tamika Felder's story. And so once again, I just want to thank you for the work and the mission that you're doing and bringing awareness around this cervical cancer. And so now we will move into our presentation of certificates, which will be Kanisha Cole Johnson.
Good evening, everyone. My name is Keisha Nyoko Johnson, and I am a member of the Health Committee. I'm glad to be able to present the presentations today. First of all, I want to thank each of you for your service, dedication to the education and awareness for early detection of cervical cancer. I also want to make sure that you all know that, especially Ms. Founder, I want to thank you for your transparency and your advocacy, along with Dr. Johnson, for your research and everything that each of you has done in order to promote people of color to be aware of cervical cancer. We have 2 certificates to present to you and a small token of our appreciation. And the certificates read, certificate, the National Coalition of 100 Black Women, Greater New Orleans Chapter, certificate of appreciation hereby granted to Dr. Denise Rubion Johnson for an outstanding presentation awarded January 13th, 2021. And it's signed, the one you received will be signed by Dr. Santino and the health chair and Miss Mendoza, who is the president. The second certificate reads the same, except for it says that it's for Miss Tamika Felder. I hope I said your name right. And it's also, I wrote it down ebonically on a piece of paper. It's also signed accordingly by Dr. Santino, who is the chair of the health committee, and the president, Ms. Mendoza. Thank you, ladies, both again for your great presentations.
Thank you so much. Thank you all for having me and helping eradicate cervical cancer, because we can.
I want to say thank you as well, y'all. I really appreciate the honor, but the honor is being blessed to be able to provide for women who are less fortunate, who otherwise, if we didn't have programs like this, wouldn't get the care that women who are more fortunate get. And women don't have to die needlessly because of programs like this, because we do serve the underserved and low-income women. So I thank y'all for allowing me this forum. And Elder, I thank you for taking the time to share your story with everybody, because it is inspirational, and it's nothing worse than doctor shaming. And you know, when doctor shame, it's terrible. You know, they give up hope of having a relationship with the patients once they do things like that. Because I can remember when I had my own clinic, and my one rule that I had with the doctors who trained through my clinic, the interns and the residents would train through my clinic. I only had one rule. And that one rule was, when you pass through that waiting room of all those women sitting in the waiting room, you say, "Good morning." And they just couldn't get that concept. These 40 and 30-year-old men and women who are future doctors telling me, "You want us to speak to the patients?" And I'm like, "Yes, I want you to say good morning." You know, if their mom raised them right, that wouldn't even have to be a question. But you're gonna call somebody in their 70s and 60s, Jane Doe, you call them by their first name. You can't do that in this clinic. And you have to say good morning when you pass through that room. So, you know, if you starting out wrong, you're gonna end up with a doctor like Ms. Felder had, talking about your weight and stuff like that, because it's just a lack of respect and not good bedside manner at all. My clinic, we prayed every day before clinic started. And it wasn't a popular thing to do, because the other providers I work with, doctors don't want you to waste time praying, as they call it. But to me, it's not a waste of time, because once you tell that woman she has breast cancer or cervical cancer or any kind of cancer, they don't hear nothing else you have to say. But if you could take just a minute just to say a prayer to let them know that I see you as a person, not just as a patient. And it's but by the grace of God, there go I. So if you can acknowledge that and pray with them and ease their fears. I have had so many women come back 4, 5, 10 years later saying, "Thank you, Dr. Johnson, for taking the time to pray with me, because once you prayed, I knew I had a chance." So it's important in the way a provider approaches a patient that will make them feel comfortable enough to talk about things. Because y'all, I got to tell you a quick little story. It only takes a minute, but I'm doing telemedicine right now, which is so different from me, because I'm older than a lot of providers that's in this arena who's doing telemedicine, these 30 and 40-year-olds. And they were so overwhelmed one day, they said, "Dr. Johnson, do you mind taking a cervical patient?" Now, LSU has medicine. They also have animals and stuff like that. So they said, "Can you take a cervical patient, because we're overwhelmed?" I'm doing breasts. I said, "Sure." So the young lady gets on the call, and I'm seeing her like I'm seeing y'all, just a little square. So I said, "Hi, I'm Dr. Johnson. What brings you here today?" Well, she's 18 years old, and she said, there's something wrong with my cat. And I was kind of taken aback because I said, your cat? I said, I think they put you in the wrong queue. We don't see animals on this side. But because LSU has animals, it didn't dawn upon me that somebody's going to get on this call and say, my cat. So she was upset with me. She said, who are you calling an animal? And I'm like, I'm not calling you an animal, but I had to bring that conversation to reel her back in because I would have lost her as a client, because it didn't dawn upon me that somebody's going to call a body part dad on a television screen. So I made her feel at ease. We started talking. So I said, okay, well, tell me something about your symptoms. All of a sudden, the phone on her camera pans downward. She's showing me her vagina. And I'm like, baby, what is that? She said, well, that's my cat. So, it's trying to educate them to feel comfortable, but at the same time, be tactful with your comfort. I don't want to see that body part on a TV screen. I can see that in the clinic because that's what I'm trained to do, but not on a TV screen. And those calls are recorded. So many people saw that it was like, you got to do a better job of educating. I said, y'all, I can't take no more cervical patients, not in this little box, because I was ready to hang up. I was so embarrassed for the both of us. Thank you, Ms. Felder, because making the patient feel comfortable, it is a lot, and that's important.
Definitely. Thank you for sharing that, Ms. Denise. And we do have a lot of education that we still have to do.
Yes.
Around these areas and many other health disparities. So thank you for that story, and we really, really appreciate it. And once again, thank you, Ms. Felder, for sharing your story and what you're doing to be impactful with this population of women. So that brings us to our acknowledgments and remarks. Dr. Erica Murray, which is also a health committee member.
Good evening, ladies. I am Dr. Erica Murray Bozeman. I am a proud member of the National Coalition of 100 Black Women, Greater New Orleans chapter, and of course, a member of the Health Committee. I would like to express special thanks of gratitude to our president, Ms. Gemma Mendoza, for your leadership, to the Health Committee chairperson, Dr. Patrice Centino, for your extraordinary commitment to women's health, and our phenomenal guest speakers, both Dr. Denise Rubion Johnson and Ms. Tamika Felder, for accepting the Health Committee's invitation to share your gifts of knowledge with everyone who tuned in tonight on Zoom and via our Facebook Live. Additionally, in all humbleness and gratefulness to the members of the Health Committee who have worked diligently to bring this event forward from mere ideas to something concrete and very powerful. This event could not have been accomplished without the support of the following members: Ms. Centrell Alfred Ewell, Ms. Reagan Collins, Ms. Kishinioko Johnson, Ms. Cabrina Smith, Ms. Kimberly Thompson, Ms. Chantel Washington, Mrs. Rochelle Woodford, Ms. Leah Wright, Mrs. Angie Nash, Ms. Michelle Zellner, Ms. Lisa Ray Diggs, Ms. Natasha Albert, Ms. Tonya Harris, Ms. Lena Fountain, Ms. Tanya Ralph, Ms. Amy Turner, Ms. Chanel Ware Lee, and Ms. Geraldine Wesley Coleman. To our guests, it is with great comfort and relief to know that you all were willing to take time out of your schedules after a full day of work to be empowered with information that will assist you in the utmost care of your bodies and the decision to own your health care. You are really the heroes on this call. The National Coalition of 100 Black Women of Greater New Orleans, we pride ourselves on being viable community partners for Black women and girls. Now, for each of you who have participated in this event, we will have a drive-by pickup on January the 16th, 2021 from 11 a.m. until noon at the Goodwill Technical College, which is located at 2714 Canal Street, New Orleans, Louisiana, 70119. You will receive a gift bag with more information about women's health care and cervical cancer. We look forward to seeing you on Saturday, and I will put the address and the time in the chat box. Thank you.
Thank you. And so the last part of our program is we always bring a call to action, right? We always bring a call to action. And so once we become educated, right, ladies, we must bring awareness and educate others. And so each and every woman is at risk for cervical cancer, and awareness is the first step towards prevention. And so we as women have to be educated ourselves to make sure that we are able to hold that torch and transfer it on and making sure that we're educating others. Cervical cancer is a preventative disease. It is also curable if detected early and adequately treated. And so statistically, CDC has shown that Black women in the United States are 40% more likely to get cervical cancer. They have a lower 5-year survival rate, ladies, and twice cervical cancer mortality rate, right? Compared to white women or any other race, and they're dying faster and quicker than any other race. And so we know African-American women has to be educated around this issue, because if it's preventative, half the battle is knowing that you just need to get a pap test, right? You just need to get a vaccine to prevent this. And so, but also because of the delays in screenings, also Black women are more likely to be diagnosed with advanced cervical cancer than any other racial group. And so, like I shared my testimony, I got diagnosed early on. So I was able to get those cells frozen and be treated. But oftentimes women don't get the treatment that they need. And when they find out, they're in advanced stages. And so, but that can all be preventative. It's just about education. And so, according to the CDC, although in the past 40 years, the number of cases of cervical cancer and the number of deaths have dramatically dropped, right? But this decline is largely due to results of more women getting regular pap tests, as well as detecting abnormal cells before they turn into cancer. So we have a lot of work to do, ladies. We have to go into our communities. We have to go into our circles and make sure we are bringing awareness on our jobs, our social media platforms, to bring awareness around this. And so we all have the ability to educate ourselves and advocate for the changes that are needed. First, we must educate ourselves, right? And being an advocate for change requires us to be well informed. We have to be informed, women. If we're not informed, ladies, how can we inform others? So we have to be informed, right? We have to engage in conversations on these topics. And then we do what we can within our social circles. Like I said earlier, social media platforms, in the event in informing others, right? The importance of pap tests, to direct those to that has been recently diagnosed to resources and information providers, as well as we have to amplify our Black voices in this area, whether that looks like following, sharing, engaging more in the Black community, to expand our perspectives on health struggles that are experienced by Black women, and to help make wellness an accessible part of their lives, our lives, right? And so we have to do these things. And so with ending today's education session, I just definitely want to highlight, I can't say it, I appreciate our guest speakers. And I would like to thank our participants, our guest speakers, Dr. Denise Johnson with the Louisiana Breast Cancer and Cervical Cancer Program, the New Orleans site, Ms. Tamika Felder with Survivor Inc. For partnering with us on this event, as well as the members of the Health Committee for putting this event on. And so once again, I would like to thank you all. And ladies, let's continue to bring awareness and education around this issue, because it is preventative, and we can be an active voice in eradicating this disease from killing, especially African-American women. So thank you. That concludes our health session tonight. And we look forward to working together in the future with maybe Ms. Felder and Ms. Rubion Johnson in bringing more awareness around this issue in the future. So thank you once again, and that concludes our education session tonight. And one thing I want to say, every Tuesday is teal day, and so if you can wear teal in representation of Cervical Cancer Month and take a selfie or a photo and send it to us, post it on your Facebook, that every Tuesday for the month of January, we want to represent Cervical Cancer Month and bringing awareness around that. So thank you, ladies. Have a good night, and I appreciate all of you.
Bye. Thank you.
Thank you.